Assess the client's treatment area and mark the treatment area. If marking the abdomen, take note of the umbilicus or belly button. If the applicator is to be placed over the umbilicus, ensure the umbilicus is fully covered by one of the 6 treatment zones. Before starting the treatment, turn that zone off. Instruct the patient on use of the pause button. Place the client use pause button within easy reach of the patient. The patient does not need to hold the patient pause button during the treatment. Plug in the client use pause button at the monopolar 1 port, and the durable connector should be plugged into the smart port. Apply the applicator to the treatment area while the patient is in the position they will be treated or in a position closely approximated to their treatment position. If possible, leave the top clear protector over the numbered zones intact until after application to the tissue is complete. Carefully remove the 2 clear underside protective sheets to expose the sticky, adhesive hydrogel surface of the applicator. Minimize touching the exposed hydrogel and avoid sharply bending the applicator. Apply the applicator to the tissue by starting at rounded axis of the applicator. Slowly and firmly apply the rounded end of the applicator and gradually roll the applicator onto the tissue, smoothing with your free hand to ensure adherence to the tissue. Press firmly to smooth the applicator to ensure full contact with the tissue, with no bubbles, folds, or air pockets. Smooth down the spine of the applicator and all zones. Remove the top clear covering. Connect the durable connector and place a drape between the durable connector and the patient's skin. After starting the system, choose the Smart Port mode from the home screen. The treatment provider must check off or acknowledge 3 prompts before proceeding. Press the patient pause button, confirm that the body neutral pad is connected, and a reminder to disable the zone that covers the umbilicus or belly button. After the prompts are checked, the standard mode treatment screen will appear. Press the Advanced Mode button to access the Advanced Mode screen. On the Advanced Mode screen, you can access specific temperature controls for any of the 6 zones or turn off a zone that covers the umbilicus. Swipe the zone to the right to turn off. Press the Start button to begin treatment. During treatment, pressing the Relief button provides 5 seconds of the energy being turned off. The treatment counter remains active and will continue its countdown. Energy resumes automatically. Touch the up or down arrows to toggle the temperature set points. Always solicit patient feedback during the treatments and adjust the target temperature accordingly. Unlock the control by touching the center lock symbol. Touch the zone you wish to adjust and use the up and down arrows to toggle the temperature set point. If an adjustment needs to be made to the applicator, you must first pause the treatment. A yellow pause notification appears. When finished adjusting or smoothing out any air pockets, resume the treatment by pressing the Start button. If it's desired to end the treatment, you may press the End Treatment button after the treatment is paused. The FlexSure treatment is completed when the 15 minutes has elapsed on the timer and the treatment complete screen appears. Touch the OK button. Remove the durable connector. Then, remove the applicator by gently lifting the rounded end of the applicator. Gently peel the applicator away from the tissue. Note that Zone 2 lacks erythema compared to the other zones. This is an example of a straight application on the arm. The long axis of the applicator is adhered in a straight line to the back, posterior of the arm. Press firmly to smooth the applicator to ensure full contact with the tissue with no bubbles, folds, or air pockets. Smooth down the spine of the applicator and all zones. Plan where the durable connector will be attached as to avoid stress on the connector. Support the arm on a pillow. Do not allow the applicator to come in contact with any other surfaces, such as an armrest, bed, or pillow during treatment. This is an example of a spiral application on the arm. The applicator is wrapped from inside the arm closest to the armpit, axilla, and slightly curling the applicator up and around the arm, making sure to cover the intended treatment area. By using the spiral method, the edges of the applicator are unlikely to touch each other when applied to thinner arms. Support the forearm on a pillow. Do not allow the applicator to come in contact with any other surfaces such as an armrest, bed, or pillow during treatment. Connect the durable connector with paper drape, ensuring there is no tension or pulling on the applicator. This is an example of a straight application on the thigh. The applicator is placed with the long axis along the thigh in a straight line. Place a drape between the durable connector and the skin. Ensure that the edges of the applicator have at least 3 inches of separation. This example shows an incorrect application due to less than 3 inches of separation of the edges.